Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about lumbar sympathetic blocks. A sympathetic block is a procedure used to relieve pain in the lower extremities from several neurologic and vascular conditions. The sympathetic nerves come out from the spine and they regulate a lot of behind-the-scenes activities such as activating sweat, dilating blood vessels, the fight or flight phenomenon. This is all called the autonomic nervous system. So who does well with the lumbar sympathetic block? Well, first and foremost, those who have RSD or CRPS. This is when the sympathetic nervous system has been activated and it just doesn't stop. It just keeps going. Phantom limb pain can benefit both herpetic neuralgia, shingles, cancer pain, pelvic pain, and then non-operative peripheral vascular disease. The procedure is performed by having the patient lay on his or her stomach on an X-ray compatible table. Usually IV sedation is administered. The pain doctor can go unilateral or bilateral if necessary, whatever the condition calls for. Fluoroscopy is used for real-time X-ray guidance. Oftentimes dye is placed once the needle is assumed to be accurate to make sure that it's not in a blood vessel. And then once it's deemed to be accurate, numbing medicine plus or minus some steroid is placed into the treatment area. A pain doctor can use phenol, which is an alcohol derivative, for longer lasting results, or pulsed radiofrequency ablation can give longer lasting results. Here is a picture showing the patient's back and then the spine and the needle going around the spine to the area where the sympathetic nerves are. Are there risks? There's a small risk of infection, nerve injury, bleeding, anesthesia, allergy. There's also a really small risk of a dropped lung or some temporary numbness. Typically right away patients will notice an increased temperature in the leg and the veins feel full. This is normal. It means the block was positioned correctly. A temperature increase of 2 degrees Celsius denotes a successful block. What are the outcomes? Well, sympathetic blocks have been shown to be an excellent pain relieving procedure for those suffering from RSD and CRPS. Oral opiates just don't help a lot with those conditions, so the blocks may be very effective. There's a lot of small studies showing the benefit for other things like the peripheral vascular disease and phantom limb pain, but no large-scale studies. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options, such as lumbar sympathetic blocks. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.